And so I'd like you to talk about grade 6 and why it can be and should be considered cancer, and also, are there other tests that we can do to these biopsy specimens to help better determine, is this a person with a clinically significant prostate cancer, or is this potentially an indolent disease that doesn't need any treatment and just casual follow-up?
Sure. Well, that's a huge and controversial and evolving topic even as we speak today. There are tests that we can do that act as adjuncts to our ability to determine whether the cancer that we're dealing with is truly one that can cause harm, or that will cause harm, or that has a low probability of causing harm down the road. Those are evolving and becoming more useful to us, but as is the issue with many of these testing and opinions, we rely on statistics, and when you rely on statistics, in a way, we're talking about populations. We're not talking about individuals. So for the individual, the discussion takes a different slant. At least in my office, when we're dealing with these Gleason 6 intermediate grade cancers, the patient often will ask, is this a cancer that's going to harm me? And the answer that I give them is, we have the ability now to watch this, recognizing that the majority of these cancers will grow and develop slowly. That can buy you 10 or 15 years, in many cases, of disease-free, symptom-free, and side effect-free life. And the advantage of that is that we are essentially buying a patient a lot of time without the negative side effects of the treatments that we would otherwise be offering them if they were worried about or wanting treatment for that cancer. So that's a huge change in the last 5 years over what we were universally doing before, which was scaring patients into saying that they need treatment and they should be treated because this will progress. We have discovered through research and through statistics that many of these diseases in the low volume do not progress, or do not progress at a rate that is clinically relevant to the patient. And so if we watch them carefully, and that's different than doing nothing, but if we watch them carefully, they can over time be spared complications yet not miss the boat. So if 5 to 10 years down the road, their PSA does start to accelerate and the disease process does start to grow, we are still in a position to cure them potentially, or at least give them extended disease-free life by acting, but only at a later date. So I think that has been a huge and very positive change for patients and for their management.